Welcome to my channel All Information. Today we discuss the health benefits of tomatoes. There are plenty of ways to eat a tomato and potentially reap its many benefits. Tomatoes are technically a fruit because they fit the botanical definition of one. They are the fleshy parts of a plant that surround its seeds. However, for nutritional and culinary purposes, tomatoes are considered a vegetable. Due to their taste, use in meals, and nutrient content. Tomato nutrition facts. For ripe, red tomatoes, 100 grams have the following, according to the USDA, 2. US Department of Agriculture. Tomatoes, red, ripe, raw, year-round average. Calories, 18 calories. Fat, less than 1 gram cholesterol, 0 mg sodium, 5 mg carbohydrates, 3.89 grams fiber, 1.20 grams protein, less than 1 gram. Tomatoes are low in calories and provide important nutrients like vitamin C and potassium. They're also rich in antioxidants. One called lycopene, responsible for tomatoes' characteristic color, is linked to several benefits, such as a reduced risk of heart disease and certain cancers. Research shows that tomatoes in many forms, fresh, cooked and as juice, help protect against chronic diseases and support a physically active lifestyle. May help protect brain health. In America, 10% of adults aged 65 years or older have Alzheimer's disease. The disease, which affects memory, thinking, and behavior, is a form of dementia that has no cure and that gets worse over time. While more research on the connection between tomatoes and AD is needed, studies have suggested that the antioxidants in tomatoes, such as lycopene, may protect against neurodegenerative diseases like AD. One study showed that, over 4 years, there was a slower decline in cognitive function among participants aged 70 years or older who had a high lycopene intake. More research on humans, specifically on adults aged 60 to 65, is needed to better understand the true connection between the potential protective benefits of tomatoes and AD and other neurodegenerative diseases like Parkinson's disease. May help combat metabolic syndrome. Metabolic syndrome is a group of conditions that increase the risk of heart disease, diabetes, stroke, and other serious health problems. It involves having 3 or more of the following conditions. 1. A large waistline. 2. High blood pressure. 3. High blood sugar. 4. High triglycerides or blood fats. 5. Low, good, HDL cholesterol. About 1 in 3 US adults has metabolic syndrome. 6 Researchers say that lycopene status, meaning the amount of lycopene in the blood, or lycopene consumption may be associated with favorable changes to the components of metabolic syndrome, and tomatoes are a major contributor of lycopene. For one small study, 15 participants drank tomato juice once a day 4 times per week for 2 months with no specified amount. Despite the lack of a standardized portion of the juice, the group experienced significant decreases in bad LDL cholesterol, increases in good HDL cholesterol, and improvements in fasting insulin levels. Helps protect heart health. A tomato-rich diet has been linked to a reduced risk of heart disease, the leading cause of death for adults in the US. One review of 25 previously published studies reported that a high intake of lycopene, as well as high blood levels of the antioxidant, reduced the risk of heart disease by 14%. Another study of healthy people looked at the effect of a single dose of raw tomatoes, tomato sauce, or tomato sauce plus olive oil on measurements related to heart disease risk. All 3 doses reduced blood cholesterol and triglycerides, a type of fat in your blood, and raised HDL cholesterol and anti-inflammatory levels. The tomato sauce plus olive oil had the maximum effect, likely because the olive oil boosted the absorption of lycopene. May help prevent constipation. Inadequate fluid and fiber can trigger constipation. Tomatoes provide both nutrients, with 1 whole tomato containing over 4 ounces of fluid and 1.5 grams of fiber. The water content and dietary fibers found in tomatoes are known to support hydration and healthy bowel movements. Tomatoes are an important source of both soluble and insoluble dietary fibers. Soluble fiber retains water to create a gel-like texture during digestion, while insoluble fiber adds bulk to stool. Both of these changes form waste that is easier to pass. Specifically, the cellulose, hemicelluloses, and pectins fibers in tomatoes are resistant to digestion in the large intestine and help form healthy stool. may help prevent type 2 diabetes. Among US adults, 14.7% have type 2 diabetes and 38% have prediabetes, when blood sugar levels are too high but not yet high enough to be diagnosed as type 2 diabetes. Some research shows that the antioxidant properties of lycopene contribute to the prevention of type 2 diabetes. This is due to its ability to protect cells from damage, reduce inflammation, and boost the body's defense mechanisms. Tomatoes fiber can also help protect against diabetes. May reduce cancer risk. Lycopene and beta-carotene, two antioxidants found in tomatoes, have been shown to possess anti-cancer properties. They do this in part by protecting against the kind of DNA damage in cells that can lead to the development of cancer and by causing cancer cells to die off. Several studies have found that men with higher intakes of tomatoes, particularly cooked tomatoes, have a lower risk of prostate cancer. And, as a whole, eating non-starchy vegetables like tomatoes has been linked to a lower risk of estrogen receptor, negative breast tumors as well as cancer of the colon, rectum, lung, stomach, and upper aerodigestive tract, like the mouth, throat, and nasal sinuses. May support exercise recovery. Exercise can damage proteins in the body, and research shows that the antioxidants in tomatoes may help offset the effects. One study in athletes found that taking 3.5 ounces of tomato juice for 2 months post-exercise improved the athlete's recovery. In another study, 15 healthy non-athletes exercised for 20 minutes on a bicycle after drinking 5 ounces of tomato juice for 5 weeks, followed by 5 weeks without tomato juice, and another 5 weeks with the juice. Blood samples showed that when the tomato juice was consumed, there were significantly lower blood markers associated with exercise-triggered damage. May aid immune function. The vitamin C and beta-carotene in tomato juice may help support the immune system. One study found that tomato juice significantly increased levels of immune cells, including a type called natural killer cells known to fend off viruses. May support male fertility. One study looked at the effects of a daily 190 grams, almost 7 ounces, of tomato juice vs an antioxidant capsule or a placebo among male infertility patients for 12 weeks. Compared to the control, placebo, group, the tomato juice significantly increased blood lycopene levels in the men and the movement of sperm, an indicator of fertility. The antioxidant capsule, however, showed no significant improvements. Thank you very much for watching this video, and if you like this video please subscribe to our channel and don't forget to like, share, and comment.